Why do COPD patients get chronic cough from GERD? Have you ever wondered why some people with chronic obstructive pulmonary disease experience a chronic cough? It turns out that gastroesophageal reflux disease plays a significant role in this issue. When stomach contents flow back into the esophagus, they can irritate the airways and lungs, leading to a persistent cough. This is especially true for individuals with chronic obstructive pulmonary disease, or COPD. In COPD, several factors contribute to the severity of chronic cough linked to gastroesophageal reflux disease. First, COPD can weaken the muscles that help with swallowing. This makes it easier for stomach acid to flow back into the esophagus and harder for the body to clear it. When this happens, the airways are exposed to irritants, triggering a cough reflex. Another factor is the function of the lower esophageal sphincter, which is a muscle that acts as a valve to keep stomach contents from moving upward. In people with COPD, the pressure in this muscle can be lower than normal. This is often due to the effects of smoking or nicotine, making reflux more frequent and severe. Additionally, COPD can disrupt the normal coordination of breathing and swallowing. This means that individuals may swallow while inhaling, which can increase the risk of stomach contents entering the airways. When this happens, it can lead to irritation and trigger a cough. Microaspiration is another concern. This occurs when small amounts of stomach contents are inhaled into the airways, causing irritation to the bronchial tubes and lung tissue. This irritation activates cough receptors, resulting in a chronic cough. Moreover, having gastroesophageal reflux disease can worsen the symptoms of COPD. This can lead to more frequent exacerbations, which are episodes where symptoms become more severe. A worsening cough is often one of the key signs during these episodes. Managing gastroesophageal reflux disease in individuals with COPD is essential. Lifestyle changes, such as adjusting diet and managing weight, can be helpful. Medications that reduce acid reflux are also commonly used. In some cases, treatments to improve swallowing and airway protection may be necessary. Addressing gastroesophageal reflux disease can help reduce chronic cough and may even decrease the frequency of COPD exacerbations. Understanding this connection is vital for improving the quality of life for those living with chronic obstructive pulmonary disease.